Hi, I'm Dr. Brian Warden. I'm a Stanford-trained ear, nose, and throat specialist. I've been in practice for 15 years, and I'm here today to share some additional useful insights about tinnitus. And our topic of discussion today is going to be hearing aids. And this is a common topic of discussion in my clinic when I'm talking with patients that are bothered by persistent tinnitus. And a common question that I get from patients is, will hearing aids really help me if I'm more bothered by tinnitus than I am by the hearing loss? And I think that is really a question that's worth some additional exploration. So let's talk more about it. It's first important to understand that the majority of people that have tinnitus have some underlying hearing loss. And most experts in tinnitus feel like hearing loss plays a major role in the processes that result in tinnitus generation. Most theories about tinnitus have something to do with tinnitus being a side effect of natural compensatory mechanisms that occur in the brain in response to decreased stimulation because of hearing loss. When somebody has a hearing loss because of prior loud noise exposure, or just because they're getting older, or maybe medications that they've taken in the past, there's less stimulation coming from the inner ears to the areas of the brain that are typically receiving and processing that kind of auditory input. And when the brain is not receiving that kind of stimulation, it reacts to that reduced stimulation situation. And one of the leading theories is that the brain reacts to decreased stimulation in the setting of hearing loss by trying to amplify the signals coming from the inner ear. The brain is turning up the volume inside of a person's head. And in that process of amplifying the electrical signals coming from the inner ear, some people start to perceive some of the background electrical information in the auditory pathways as a sound that's not there. That is what we call tinnitus. And that same process explains why many people with tinnitus also report increased sensitivity to certain environmental sounds. Now, the most common pattern of hearing loss that we see in people with tinnitus is a hearing loss that predominantly affects the highest frequencies of human hearing. And that is something that we usually also see in people as they get older and people that have prior loud noise exposure that has damaged their inner ears. Now, traditionally, in the past, hearing aids would be recommended to people when they had a hearing loss that was affecting their ability to communicate with people and impairing their quality of life. However, there has been some more research that has shown that hearing aids can benefit people in other ways as well, likely because they are increasing the stimulation of the brain by exposing us to more sound information than we otherwise would receive in the setting of hearing loss. And some studies suggest that wearing hearing aids can actually improve memory, can improve mental processing time, executive function, and even reduce the risk of developing dementia years down the road. So how is it that hearing aids help somebody that have tinnitus? Well, the thought is that first of all, the hearing aids are amplifying environmental sounds that a person is otherwise not hearing well. And by amplifying those environmental sounds, it partially drowns out the sound of the tinnitus. And so the tinnitus signal then becomes less significant relative to the background soundscape. And when the tinnitus doesn't stand out quite as much, it's easier to ignore and it's less bothersome to people. We also feel that the hearing aids, by amplifying certain sound signals, are also helping to continue stimulating these areas of the brain that are used to receiving and processing sound information. And by maintaining that stimulation, we may help to prevent progression of tinnitus in the future. Because as we talked about before, we feel like the generation of tinnitus is often related to how the brain reacts to that decreased stimulation in the setting of hearing loss. So, Theories are theories, but is there really any scientific evidence that wearing hearing aids actually improves tinnitus? And to answer that question, absolutely there is. There are a number of studies that have been done that examine that specific question. There was actually a well-researched meta-analysis published in the American Journal of Audiology in 2022 that reviewed the data from 27 different studies that investigated how hearing aids can benefit people with tinnitus. And they pooled all of the data from all of those studies. And the pooled data clearly showed that wearing well-fitted and programmed hearing aids not only reduce the perceived loudness of tinnitus, but also measures of tinnitus-related distress. And interestingly, they also were able to observe that the improvements in tinnitus-related distress achieved by wearing hearing aids actually improved over time with ongoing use of the hearing aids. So the bottom line is this. For patients that have bothersome intrusive tinnitus and hearing loss of greater than a mild degree, I highly recommend getting fitted for digital programmable hearing aids because it's very, very likely to help improve the severity of tinnitus and the bother of tinnitus, and there's very little downside to it. So thanks again for watching the video. Again, if you're watching through our YouTube channel, please like the video and please subscribe to our channel. If you're watching through Facebook or Instagram, we appreciate the likes and you can follow us on those platforms. I always appreciate any sort of comments also, and if you have any suggestions for other topics that you'd like me to discuss in future videos, I'd be happy to review that. So wishing you the best. And I'm hopeful that these useful videos will help alleviate the burden of your tinnitus moving forward. Have a great day.